everyone, and welcome back to our monthly Let's Talk series. Thank you for taking time out of your busy day to join us. I'm excited about our guest today. I will introduce you to her a little later, but I'm going to talk about a few things we have going on. So first, I'm going to talk about Lunch and Learns. They're back, and I can't wait to see you guys. Of course, we will be upholding mask and CDC regulations. But for right now, we do ask and request that you wear a mask. So the Lunch and Learns will include at this time Little Rock every first Wednesday, Conway every second Wednesday, and if you go to our website alzark.org, you can get information about the locations. I'm so excited about tomorrow. Tomorrow we are doing a resource fair, stepping out at the city center from 10 to 2. They're on Shackelford Road. So if you want information about that as well, please come out. We have vendors, all kind of resources. We have free food. We have the opportunity to get a vaccination if you like one. So please visit our website or look on our Facebook page and you can get information about that. And of course, you can visit us every third Thursday here on Let's Talk, and we can get you the information that's imperative and important to you. So just kind of let me know what you want to talk about. Inbox us, message me, call me in the office, and we would like to get that information out to you. So we're going to get started. Today I have Karen Shelton.
Hi.
Hey, Karen, how are you?
Well, thank you.
It's so good to see your smiling face on this cloudy day. Thank you I know you're a busy lady and just taking your time to come out to educate our audience on long-term care, skilled nursing, however some people use that. And you're going to tell us the difference, right? Educate us on some things.
Right.
So Karen is the marketing director for ConvaCare, and she actually markets for 4, am I correct?
Yes.
4, so you can name them. So what I'll do is let Karen tell us a little about herself, because I know she knows more about herself than I do, right, Karen? So tell us a little about yourself before we get started.
Well, thank you for having me. I appreciate that. Basically, I've been in this industry for about the last 8 years. I do work for ConvaCare with their 4 facilities in Little Rock: LA Health and Rehab, Barrow Creek Health and Rehab, Cottage Lane Health and Rehab, and the Village at Valley Ranch. And so I get to go out and give information to the public and to the hospitals about the things that we do. And one of the things that does constantly get asked is, what is the difference between a SNF and long-term care? And so basically, when you're looking at a SNF, that is called skilled nursing facility. And when you're looking for that, you're actually looking for a place for a patient to do rehab and go back to home. And so every long-term care facility has normally a wing that is specifically a SNF wing. And then their other rooms are available for long-term care. Those that may do rehab but end up staying long-term care are those that come from home, who the caregivers just need that extra 24/7 availability with nursing.
So when you talk about rehab, I hear a lot of people. First, I want to thank you too, because
you're welcome.
You have educated me when I needed personal help, and you came to me and you were a great help, and I want to thank you for that as well. So, but I also hear this a lot, and I've heard a lot, like a lot of times loved ones are kind of hesitant for rehab or SNF in nursing homes because they always seem to think that there's a decline in rehab, and they usually kind of stay there. Is that?
No, that's not our goal. That's not our goal, is to bring someone into rehab and try to keep them. Our goal is to rehabilitate them to a baseline or better level than what they come into us in rehab. And so we have very skilled therapists in all three disciplines, physical, occupational, and speech, that work with the families to see where that individual was prior to their hospitalization. And so it is our goal to always try to get them back in their home environment, because that's where they want to go back. Unfortunately, though, sometimes their level of acuity and care is just too much for a family to handle. And so that's when, during our care plan with our team of staff and therapists, then have that conversation with the family that this is the next, stage for this individual. And, we start talking long-term care with them.
Okay, so this question has to do with managed care versus Medicare, because Medicare only pays for SNF or rehab, correct?
Correct. So a lot of people who get the letters in the mail, who see the commercials with managed care, they see how more cost effective they think it may be than regular Medicare. In our particular industry, though, what happens is you bring someone in for rehab, and with them being managed care, managed care, we have to do a pre-cert. They dictate and kind of tell us if that person can come into a skilled nursing facility or not. Whereas if they were regular Medicare, as long as they had skillable needs, those that needed rehab, a diagnosis, we could bring them in without hesitation.
So a pre-cert means pre-certification, correct?
Yes.
Just for,
yes.
Okay.
We have to have permission from the insurance to bring them in. But the other dynamic with managed care is a lot of times they have an out-of-pocket amount that normally is pretty expensive. And versus with Medicare, you don't have an out-of-pocket that you have to pay up front. Your days 0 through 20 or days 1 through 20, Medicare Part A pays 100% of that.
Okay.
Days 21 through 100, there is a Medicare copay. And so if you have a secondary insurance, majority of time that will be picked up by that insurance, or a long-term care facility with the help of the family can try to qualify them for long-term care Medicaid, which, if approved, would pick up that copay for days 21 through 100. So, it's just always best to shop around. I think you have to do what's best for you and your family. But definitely, if you're looking into a managed care, just research it. Research the things that, if you're an older adult, obviously, research if you're going to be out of pocket, if you have deductibles versus if you were regular Medicare, and that you would not have those.
Okay, so Medicare has no out-of-pocket cost for the first 20 days.
Correct.
Basically. And if you have a diagnosis, you don't have to have permission. You can get the services rendered that you need.
Correct.
Okay.
Now, if you've been in the hospital, if you've not had a 60-day wellness with Medicare, if you've been in and out of the hospital, you don't regenerate your Medicare days until you've had a 60-day wellness. So let's just say I was in the hospital last month. I went to a skilled nursing facility and used 21 days and went home, thought I was fine, but then ended up in the hospital. I don't get to start those days over and get those free 20 days.
Okay.
I will start at day 21, and those are how many days I have left out of the 100. So you get every 60 days, if you've had a wellness stay with no hospitalization, you get 100 days at a time.
So is that why home health is important?
Well, home health is important for a couple of reasons. Obviously, with skilled nursing facilities, what we do once they've been rehabilitated and we feel like they're at a level of rehab that they can go home, we transition our patients to home health services.
Okay.
They have within 30 days of a hospitalization of going back into a skilled nursing facility. And so let's just say Miss Smith decides, I really don't want to go anywhere. I'm tired. I want to sleep in my own bed. I don't want to go to skilled, to rehab. She has 30 days from the time that she discharges from a hospital if she's Part A. And so most managed cares too work that way, to say, look, I'm not doing as good as I can. I think if I had a little bit more extensive therapy, I would be a little bit better off. And so we can bring that person in within that 30 days of that hospitalization for skilled nursing.
Okay. So if you have skilled nursing at home, does that count as that 60 days of wellness, or does that count against? Does that make sense?
Yeah, no. So home health bills a little differently. They don't bill necessarily the way we do, and so it doesn't go against them.
Okay.
Acute rehab too, which is a little bit more intense. Those days as well do not go against someone that ends up at a skilled nursing facility.
Okay. So let's talk a little bit about what has happened since COVID.
Okay.
Telemedicine and the trend there.
Yes. So it's been a very different dynamic, as everyone knows, this past year. A lot of families have not been able to see their loved ones face to face, which includes our physicians and our nurse practitioners. In our facilities, we feel like having our nurse practitioners there every day during the week really has decreased our readmission rates to hospitals, has caught a lot of illnesses that help them not to go to the hospital. And so telehealth has been a huge part with us through COVID. And so we have, with each of our families, discussed what telehealth is and how it plays out in each patient's daily living. And so our physician, our medical director, our nurse practitioners will, have a patient or resident, in front of them, just as I am with you, to examine them. And so it's been good too for a lot of our residents who may have psych issues, who have appointments monthly or quarterly with their physicians. It's allowed a little bit of different contact, but it's been very successful in our facilities.
And I know I've heard people just like praise it, especially with people with Alzheimer's and dementia and just patients that don't like to get out. It helps because, it's so difficult to get some people to go to the doctor. But if you have telemedicine, then it's an easier process. You can get them seen without getting them dressed and out. So a lot of people
definitely, yes, definitely. And this population has been very compromised through all of this, and so it's allowed them to feel a little bit safer just being at their facility, in their room, in a location where we do our telemed conferences or appointments with them.
So let's move on and talk about the need in nursing facilities for memory care or memory neighborhoods, because I think you call them memory neighborhoods, correct?
So, we don't want to put a stigma with those neighborhoods. Obviously, they're meant to keep those residents who may be elopement risk, who may be wanderers, in a safer environment. And so locked units seems a little harsh. And so, we want those to just be, neighborhoods where they feel comfortable. So we keep our memory neighborhoods very full. The need is out there. The need is out there for more. And the trend has been a lot with females, but here lately we've seen a lot of male patients with those needs. And so our facilities provide both. I have the Village at Valley Ranch, which is an all-female facility or neighborhood rather. Cottage Lane has both male and female. And then Barrow Creek Health and Rehab is more of our behavioral neighborhood. It may be those with Alzheimer's with behaviors, those that no matter what interventions have been done, those behaviors still have not subsided. And so that particular facility can house more of those patients who fall in that category.
So can you kind of touch bases on, is it the trend for men and women to be separated in memory care, and why?
Well, it really depends on the diagnosis and the behaviors that you're having. A lot of times, as you know, you will see with these, with those with this diagnosis, they may be hypersexual. Mm-hmm. And so a lot of times it's a safer environment when you can do an all sex memory unit. And so what we normally try to do, those that have co-ed, normally they can mingle throughout the day, but their quarters are completely separated. Okay. And so I think too, most families feel a little bit more comfortable with that. I think that's the majority reason why, like the Village at Valley Ranch with their all female, it stays full nonstop, because they like that safeness of just having all females.
Okay, that makes sense. So let's talk about the improved focus on the patient experience.
Okay.
A little bit. Like, what should consumers look for, like, as an improved experience? Like, because we all traditionally have this perception about long-term care. So talk about the improved experience that a loved one can get these days.
Well, I think one thing you have to keep in mind is long-term care facilities are highly regulated by the Office of Long-Term Care here in the state. And so you have regulatory compliances that you have to meet daily in those. But from the patient experience standpoint, we have to feel like that each resident feels like our facility is their home. We need those families to feel that this is their home as well, because a lot of times it's a very hard decision for families to make that choice to put them in a long-term care environment, because they want to take care of them at home. And it is hard, especially when they start requiring 24/7 care. And so through COVID, some of our better patient experiences have been, to use FaceTime, to be able to allow some one-on-one time when they couldn't see them, to do communication updates with the families, to let them know what's going on, to extend care plan meetings where all questions can be asked by a family. Our job is to provide good customer service, and that, communication is everything. So always keep that in mind. You're always your loved one's advocate. So we always want to provide, our administrator's cell phone number, our director of nursing cell phone numbers, because we need to make sure those families know if at any point in time they need something, they can contact us for that. And so I think there's always room for, to improve patient experience. One of the other things for a good patient experience is good retention of staff. Our ratios are above what the Office of Long-Term Care requires. That is because our owner, Joey Wiggins, wants to make sure that each one of those residents feel and those families feel that they're very well taken care of. And so to have really good staff retention makes a more positive patient experience.
Good. So this is one thing I want to touch on is long-term Medicaid and what you have to be admitted, because sometimes I hear family members say, I think it's time, but it takes a more than a family member to say, I think it's time, correct?
Well, it's a hard choice and it's a hard decision. And so basically my involvement is trying to answer as many questions as possible for that individual. We want to be a resource, just like you are a resource. And so even if a family decides not to come to one of my facilities, I still feel an obligation to inform them as much as possible, because it's very overwhelming. They're coming into this situation very blind because they've never had to experience this before. And a lot of times people just think, oh, well, it's just Medicaid, and I have Medicaid out in the community. And community Medicaid is completely different than long-term care Medicaid. And so there's a different checklist of information that we've got to have from the family, from the resident, from the patient, in order to bring them in for long-term care Medicaid. And so we have a checklist that we provide, and our business office managers sit down with the families and go through it step by step. We go through this whole process with them. And so we try to make it as easy as possible, and we try to help where we can as well. And so, one of my suggestions for, your families that are out there listening now is Carolyn can provide it. My information is going to be attached to this as well. We can provide you with that checklist. So if you feel like you're not ready now for long-term care facility, it's 6 months from now, you can start gathering the things that you need. That way you don't feel so emotionally, financially overwhelmed bringing your loved one in at a later date.
Okay, that makes sense. So I'm going to wrap this up by asking you this question. At the end we're ending this interview, what would you like people to glean or get from this interview? What would you like for them to know?
Well, as I just said, we want to be a resource for them. Again, whether it's, using our facility or another, allowing us to be a resource, call and ask questions. There's no, question that I've not been asked. And so if I don't know the answer, I will find the resource for you that we can get that resolved and answered for you. So, majority of us, our book of business, we all work together. And so being a great resource for them for even down the road, we're open to that. So, reach out to us.
Okay. So there's your information. It just went across the screen. So if anyone would like to directly get in contact with Karen, please use that information. And you can call our office and we can supply it as well. There's our phone number, 501-247-6573. I don't think we have any questions. You gave all the information that we need. And there's a referral fax, 501-868-8103. So if you want to get in contact with Karen, there's her information. Please feel free to call our office at 501-224-0021, and we can get you in contact with this valuable resource out here in the community. So Thank you again, Karen, and I'll see you out in the world. Maybe
Absolutely.
tomorrow. I hope. I hope.
Absolutely.
Okay, so thank you, Karen. Don't forget, we're here every third Thursday at 2 o'clock with the conversations that help you become a better caregiver. Tomorrow we will be at Stepping Out at the City Center from 10 to 2. Vaccines, free food, a lot of resources out there. So please come out and see me out there. Lunch and Learns are back. Little Rock and Conway. Go to our website at alzark.org, and we will see you in a few weeks. Thank you and have a good day. Bye, Karen.
Bye-bye.